Good evening to everyone who's been listening, and welcome back to another podcast in our Know Your Calling series. Today, we are hosting Dr. Karthik, a renowned orthopedic surgeon based from Bangalore, Karnataka. The purpose of KYC is to help people make informed choices about choosing the right branch that might suit their personality, their working style, and after knowing the ins and out of the specific branch from the consultants who are working in that branch itself. Talking about Sir is based from Bangalore, Karnataka, who with special interest in orthopedic trauma, hip, knee, and shoulder surgeries. He's gotten a proven record in patient care, surgical independence, and effective ward management. Sir is quite interested teacher who is very much interested in enhancing the expertise of the next generation and in orthopedic surgeries. Talking about the professional experience of Sir has done his fellow in sports medicine and robotic knee surgery from Manipal Hospital and Sports Orthopedic Institute, and he's currently in that role where he's actively engaged in advanced robotic assisted knee replacement procedures and comprehensive sports injury care. Sir worked as a senior resident at Dr. Chandama Dayanand Sagar Institute of Medical Education and Research from the period July 2022 to March 2025, where he provided expert orthopedic and trauma care in a 500-bedded tertiary care hospital setting. He's independently conducted surgical procedures while also assisting in complex cases under supervision. He also oversaw inpatient ward management and provided mentorship to junior residents and undergraduate medical students, while also actively engaging in clinical audits and in quality improvement initiatives to enhance patient care standards. Sir did his junior residency in orthopedics from Mysore Medical College Research Institute during the period of May 2019 to May 2022, where he provided IP and OP care, performed surgeries under guidance. He managed acute trauma and orthopedic emergencies in high pressure casualty environment. He led academic teaching sessions and actively participated in departmental scholarly activities. He also contributed to clinical governance efforts and co-authored peer-reviewed research publications. Sir did his undergraduation and internship from Vaidehi Institute of Medical Sciences and Research Institute, and Sir other qualifications include his MRCs from Edinburgh, UK, and in the year 2023. His research and publications include management of distal femur fractures treated with distal femur nail, which is published in the International Surgery of Orthopedic Sciences Journal, and another paper on tubercular arthritis of elbow mimicking as neoplasm, a case report and a review of the literature, which was published in the International Journal of Research in Orthopedics in the year 2024. Sir has taken part in various projects and presentations, and he's a certified ATLS personnel who passed out in the year 2024. And he's also completed an AO basic trauma course and basic course in biomedical research. Sir has attended various workshops and conferences at different levels and participated in clinical audits. Now we give the session to Sir to take us forward. Few words, Sir.
Thank you, Anna. That was a quite brief and a very extensive introduction. Thank you so much. And thanks to the entire team of KYC, Know Your Calling, for conducting a series of podcasts. You guys are doing a great job educating the future generation of doctors, educating them, giving them a real time picture about the various future career prospectus. Thank you so much. Thank you for having me this evening today.
I'd also like to thank Dr. Dairy for giving me this opportunity to host Dr. Karthik in his channel, Know Your Calling. As we delve into the conversation, we'll start with the introduction to the branch here. Can you provide a general overview of your branch as a specialty?
So orthopedics is a branch which mainly deals with the musculoskeletal system, as you guys are all broadly aware of. It could deal with various aspects of starting from the bone, muscle, tendon, the surrounding, all the soft tissues. And orthopedics, to be more descriptive, it deals with various aspects of such as trauma. It deals with joint replacement. It deals with some minimally invasive surgery such as arthroscopic, It deals with spine and the oncology part as well. So that's a brief overview of what we deal in orthopedics.
Yes. And what made you choose orthopedics as a branch? When did you know it was the one that you wanted to pursue?
I think it was during my internship where I really was called towards, and the way the emergencies were managed, the acute dislocations which were being treated, the fracture management, and the entire OT setup. So the team where I did my internship, that was quite inspiring, and that's where probably I decided to take up orthopedics as a future career.
And how's life generally during residency? How is the daily routine of a resident?
Um, General life as a resident, yeah, I think it depends mainly upon the institution that you take up. The institution where I did was a tertiary trauma care center. So the day of a resident usually starts with ward rounds, and then you wherein you clerk upon each patients in the ward, and then you move towards the emergency room where you manage the
I think there's a difficulty in the internet connection. Are you available?
yeah. Sorry, I think there was some network issue.
Yeah. So you're talking about the ward rounds and how the day
Am I
begins.
audible, Hannah?
Yes, sir. Now you're audible. We were talking about the daily routine of a resident.
Correct. So the entire day runs basically in and around trauma, where you manage the casualty as a whole, and there is you will be doing some basic ward management under the guidance of your seniors and the senior residents. There will be you will be operating, or you will be assisting under the guidance of various consultants, and in the clinic as well you will be examining various patients and how to do a quick diagnosis in the clinic. And in the later part of the day you will have to run the casualty under the guidance of your senior residents, managing various kind of emergencies.
Okay.
So that's the overview of a resident's day. And largely the things very depend upon how busy your center is. Some centers, especially tertiary care trauma centers, they are running 24/7, and most of the early days of your residency will quite be a very long and hectic day. But as you move towards the end of your residency, say later third, second year resident or a third year resident, the workload keeps on coming down, and it's more towards the operative side, and where you will be also enhancing your work as a resident in the form taking part in some research presentations, presenting your research work. So that is towards the later half of your residency, when you come towards the end of second year and your third year.
What kind of clinical exposure and case mix can one expect during training, sir?
So if we talk about the classical, the way we used to choose our colleges previously, it used to be we used to ask our seniors, are they good cutting chance? So cutting is something that is most of us, even when I was an intern, post intern, when I was preparing for entrance exam. So that was one of the key criteria that we were looking for. But once I finished my residency, I think the people who are looking forward to future residency, I think you should the overall residency should focus not just on cutting part, wherein you are operating or you're assisting. The other things that you should also keep in mind is how good the academics is in the institution. Are you being taught the clinical examination, the clinical diagnosis, how to reach to a clinical diagnosis? Is there good opportunity for you to do some good research work, present your research work in various conferences? Along with that is your cutting part. Yeah. But cutting alone should not be the criteria where we choose upon our residency. So it has to be a culmination of various factors, like I mentioned before.
Oh, okay, sir. And the next part of our discussion, we're talking about how demanding is the residency in terms of physical and mental stress. We'll talk about the physical part first, since it's orthopedic.
Yeah, as an orthopedic resident, yeah, it's quite physically taxing, I would say, because you would have seen how the residents, there's a lot of traction, pushing, pulling around involved in the casualty, even in the operation theaters. There is a lot of mechanical force that is involved, but that is something that you learn. You learn the knacks, you learn the tricks, tips, and tricks over a period of time. So yeah, initially the physical the stress is a lot, and when you are dealing in the casualty, you will be dealing with some harsh rough patients. So at times it can be even emotionally stressful as well, when you will have to deal with a lot of trauma. You will be seeing a lot of mortality and morbidity, because our mainly involves with the trauma and accident series. So at times it can be emotionally draining as well.
Okay. And talking about the motivation and the passion that you have for the branch, what are the different aspects of your specialty that you enjoy the most?
Sorry, can you come back again, please?
What are some of the aspects of your specialty that you enjoy the most?
Okay, so the most stressful, or the most, what I would say, gratifying part is when the patients come in an immobile state, and you do a good amount of work, you do a good surgery, and you get them going, you get them mobile. So getting mobility to the patients, in the patients who have sustained, maybe it could be in the form of a fracture, or patients who are suffering some advanced arthritis, who are not able to walk, or various spinal issues which had led to gait disorders. So when you operate them, when you see the patients, get them going back on their feet, so that's the most gratifying part, I would say. When the simplest thing is, say, most of the patients come horizontal to us, and the whole part would be getting them vertical. So I think that's the most gratifying and the part that I loved during the residency, and even right now. Yes.
You put it down so simply, sir, but for a patient, no, it
Yeah,
might mean such an improvement, such a drastic improvement in their quality of life. And
absolutely. Yes.
what inspired you to choose this specialty or other specialties? What made you think, yes, this is the one?
um, So that was the main criteria when I saw them. The you see the results are quite immediate. When the patient has got broken bones in the limbs, they're not able to walk. But you do a simpler surgery, and from day one, they get going. They're on their feet now. So getting the mobility back in the patients, and most of the results are quite immediate. You don't have to wait for some longer duration, like in other surgical branches, where you will have to wait for the final outcome, you will have to wait for certain things to heal. Of course, even the bones need to heal, but most of the things, the results that you see are quite immediate, and you don't have to wait for really long time to see some great results. So the immediate outcome and the immediate mobility is something that I really liked about this branch.
People who are looking for instant gratification, ortho should be your go-to. Okay. And talking about the challenges
Absolutely,
and
yeah.
downsides of,
That's
yeah. So what are some of the challenges and cons that are associated with the branch?
Challenges, like I mentioned, at times there can be long shifts, and the OTs can be really long and tiring. We'll be using a small amount of radiations, that is the CM, as you all are aware. So that leads to, during our residency, we have all gone through this. We have been through dehydration, and that leads to a lot of muscle bulk loss, and there is some fatigability which easily sets in when you're operating. The other challenges are the emotional stress, when you will have to deal with some really difficult patients. some difficult mobs when you're working in a busy casualty. All these are some really challenges, and that too when you're working in tertiary care center where you will have to deal with a lot of patients. So these are some challenges that we usually face in our residency. And the long working hours, long standing hours can put some stress on the physical well-being as well.
And talking about how this branch has adversely affected your health in certain aspects, Nisa, what are the various measures that you're taking in to help combat it, the muscle loss or just the generalized fatigue?
Okay, so one general advice that I would like to give to the people, to the residents who are going to planning to take up this as a future career, the first I always say is take good amount of hydration. So that is something that you have to be focusing on, because I myself had renal colicky, I had renal stones when I was a first year resident. Then I had to run up and down for various scans and some emergency procedures. So the first thing that I would always tell is keep your hydration really well. Okay. And a good proteinaceous diet. I know it's difficult to catch. I wouldn't say on time, but at least a 3 meal per day with a good amount balanced diet of some proteins is something that the residents really need to focus on. And the coming to the other part is, you need to learn the concept of team working. So when you're working in the casualty, it's not just your orthopedic colleagues, but if you're working in a multidisciplinary department, in taking the help of a general surgery resident or the other ENT and the other surgical allied branches, so involving them in your patient care, I think that that is a great thing that you can do, and it will also help you to learn the overall patient management, and that's the way forward. I think team working is something that the residents really need to look forward to.
That's such a good takeaway from this. And how has the challenges in orthopedics affected your life and career progression, sir?
Sorry, there was a network issue. Hannah, can you please repeat that question?
Yeah. So how has this challenges impacted your life and career progression?
Uh, so the biggest thing that I learned is how to handle this situation. So when you're working in this situation, the ultimate thing you want to learn is how do you deal with all this situation. So at the end of the day, what was the key takeaways when I was faced with a particular situation? So when you had probably when you had a group mob, when you were dealing with mass casualty, when you were dealing with difficult patients, when you were dealing with all the stressful time, ultimately the thing that you have to learn is how did I come out of the situation. So that is the most utmost key learning point that I would say. And the branch, I said, yeah, overall you learn the resilience over the period of time. You learn how to manage with the long working hours, how to deal with the physical stress, the physical draining part. So you learn to be resilient. And the concept, like I said, the concept of team working was something that I was keenly looking on, and I always look forward for the help of my colleagues, my seniors, engaging them in the overall patient care. So these were the things that I learned at the end of my residency. And collaboration. So collaboration is something where you take the help of your co-residents and you make them a part of your team, overall improving the patient care.
Okay, sir. Moving on to another section of discussion, we're talking about how to choose the right institute. So let's say an aspirant comes to you asking what are the different checklists that an institution should satisfy before selecting that specific college or an institute or a university. So what are the things that you would say?
Uh, First thing, an orthopedic resident, for the bread and butter of orthopedics is trauma. So a good load of trauma is something that the institution must have. And a resident who is keen on taking upon orthopedics should also look forward to. Along with that, if there is a good mixture of arthroplasties, joint replacement, and some work which is being done on minimally invasive surgery such as arthroscopy, and if there is any oncological, that's a difficult part which I did not find in my residency as well. But if there is a little bit mixture of other 3 to 4 subdivisions, I think it'll be a great a learning for the resident. But one has to accept the point that it is not a very smooth learning curve. Most of these require bit of fine tuning in the future as well. So I would say a good load of trauma with a subdivision or a mixture of other subspecialties is something that a resident should look forward and find out if that institution has got from their seniors. Uh, and I think you're muted.
So sorry, sir. So,
Yeah.
how many percent of hands-on can we expect in finer procedures like arthroscopy or in advanced procedures like for residents?
Um, I would say may not be in the first years of your residency, but as you become quite confident in dealing with at least the basic trauma and basic joint replacement procedures, towards your final year, of course, you can expect some bit. I wouldn't say it would be something like skin to skin is something that is fanatic, and I wouldn't really push for it because you really need to understand that it is, after all, a live patient that we are handling on. There is a lot of stress on the main consultant who is operating as well, but there are certain steps, basic skills, that how to handle a scope, how to navigate inside a joint using a scope is something. Those are the very very minor bits that really a resident should learn. And fine tuning, of course, there is a entire, you have your senior residency, you have your fellowships there. Those are areas that you really need to polish upon in the future days to come. But as a resident, yeah, you should be confident in doing some good trauma, maybe even periarticular fractures, and doing some basic joint replacement in the form of hemianal arthroplasties of the hip is something that you should really focus on. And if you get an opportunity to do few steps of joint replacements of knee and total replacements of hip, that will be a big bonus. Other than that, I wouldn't really say junior residents would get anything to do in the areas of spine because they're quite sensitive, delicate areas. But you should really observe how the surgeon, how the consultants handle those delicate tissues. That is something that you need to watch, and probably in the future days you can put your hands over there as well.
Okay, sir. And how much of an institute's infrastructure or caseload significantly affect the training quality?
That'll be something, a big bonus, I would say. How the operation theaters are designed, what are the equipments you have access to, and what are the other extra modalities. It could be in the form of a robot these days. That'll have a very significant impact on a resident's training program. If you are having exposure to all these equipments, you are at least exposed. At least you're not alien when you go outside. You're not alien to any of these new things. So a basic more infrastructure, a well-designed operation theater, a well-designed casualty, and how you can manage the various plants that needs to be there. I think infrastructure is one key thing, but of course, that is certainly not in the hands of a resident. That is totally a hospital management team that needs to. But of course, if you feel that something is lacking, you can bring it up with the respective heads and say that this thing, if it is being added into the armamentarium, will really help in the patient outcome. But yeah, a basic operation theater setup, a well designed casualty is something that is basic for a resident.
And talking about the types of personality who would be a better fit for the branch, what do you think are the different people who will thrive in the specialty, or what kind of mindset and personality is expected from an orthopedic resident?
And I don't think, honestly, there is a clear cut answer to this. If you are passionate, I always feel if you are passionate for a particular field, you will mold yourself to fit into that particular branch. I wouldn't say somebody is designed to be an orthopedic surgeon or somebody is designed to be another general surgeon. It depends on how you wish to take your career further. I don't think there is such particular trait, that personality trait that a person should have to become an orthopedic surgeon. Ultimately, yeah, some things that are quite important is you should know the physical stress that you'll be going through, understand the emotional draining part as well, and the mental stress. Of course, this involves all the branches for the medical branches. This is not specific to orthopedics as such, but like I said, there's no one single quality, or you can be a mixture of all the personality traits and you can still become a good orthopedic surgeon.
Okay. So I think then I should come for a converse question. What traits or expectations might make this branch a poor fit for someone? Maybe somebody who's very emotional, or do you have something to say on it?
Um, Honestly, again, the same answer fits into this as well. I don't think that there any trait should be a weak character. I wouldn't say seeing blood and other things, because you would have seen them even during your internship. You would have dealt with good amount of trauma, with the emotional straining part. So I don't think there is one particular trait that is negative to not being an orthopedic surgeon.
Okay, right. And moving to the financial and career aspects of the branch, what is the expected earning trajectory, sir? First, we'll talk about what is the earning potential during residency.
So that largely depends upon, it varies, a lot of things varies from state to state. The stipends usually in the colleges, medical colleges in North India, are paid really, I won't say decently, whereas medical colleges in South India, unfortunately, are not paid up to the mark or up to the standards, I feel. So during the residency, of course, it's quite limited. The stipend that you have, it can be varying anywhere between starting, I think the least somewhere starts around 45-50K. It can go up to 80-90K depending upon which year of residency you are in. And if you are going up to some premier institutes, the central institutes, you may reach up to six digit as well. But later on, yes, once you get into your residency, senior residency, things change a lot. There is no limit for the senior resident to how much money he can make. And again, a lot of things, when you become a consultant, sky is the limit. You can literally make the mint money as much as you wish. The kind of career that you build upon, the expertise that you possess in a particular subspecialty, it can take you to greater heights. And again, a lot of things can vary between this kind of sector that you work for. If you're working for a government hospital, things are quite fixed. But if you're working in corporates and in a private practice, like I said, sky is the only limit that you have.
Do we have some figures for the earning potential during the early years post residency?
Uh, yeah, during your residency, like it can be varying anywhere between 45 to 50K. That's the basic limit, I would say, and it can go up to a lakh. If you are in premier institutes like AIMS, JIPMER, PGI. So if you're in these premier institutes, it can go up to that level as well.
Yeah. And the post residency period, sir, during the senior resident period and then the immediate.
Most of the senior residencies, as far as I know, at least in Bangalore, they offer anywhere between 75K and going up to 1.2, 1.3 lakhs as well. So that's the salary that I'm aware of in Bangalore. Maybe the figures change a lot between places as well.
Okay, sir. And after completing MS orthopedics, what do you think are the different fellowship options that are available?
Great. So, by the end of your junior residency, and probably after 1 year of residency, this is something that most of the people should start really inclining towards one branch, one subspecialty, I would say. Um, Previously, the scope was whether you want to the broad subspecialties were arthroplasty, arthroscopy, spine, oncology, orthopedic oncology. So this was the way that things were running. But right now, it's getting even fine tuner. um, People and surgeons are becoming region specific. You can be something like a shoulder and elbow surgeon, you can be a hand and wrist microsurgeon, you can be a hip and knee surgeon. These are the things that were mainly practiced in the western world, in UK, Australia, but things are even creeping in towards in India as well. I am seeing a good amount of people who are sticking to region specific. So the fellowship that you by the time you finish a year of your senior residency, make incline yourself towards one of these subspecialties. And there are a lot of fellowship opportunities these days. Some are recognized, and there are even MCH courses which have come up in central institutes these days, and that will help you to refine your skills in a particular subspecialty.
So that was supposed to be my next question. What are the different options that we have in MCH after completing MS in orthopedics?
So that is a recent add-on, I would say. We did not have too many MCH opportunities. We had something called FNB, which is again recognized by the central board. So the FNB offers could be joint replacement, arthro sports medicine, spine, hand surgeries. But recently, I think central institutes like Delhi, AIMS Delhi, have come up with MCH in joint replacement and adult reconstruction. So that's a new add-on. We did not have too many MCH opportunities in the past, but I think it's an upcoming thing in the recent days. But yeah, fellowship are numerous. You can have a fellowship in any form of subspecialty that you wish to. Joint replacements, arthroscopy, spine, oncology, musculoskeletal injuries, trauma as such. Advanced trauma is also a subspecialty that people are focusing on these days.
Okay. And how important is super specialization or fellowship, sir? Is it compulsory?
I wouldn't say it's compulsory. Previously, we all thought orthopedics as an end branch, but I don't think that concept truly exists today. People are really keen on developing their expertise in particular subspecialty, and I think it is an era. People should, once they finish their senior residency, you should get into some solid fellowships or a FNB program or even MCH program as well. So it is becoming like a mandate these days. That's because, especially in tier 1 cities, tier 2 cities as well, people are the patients are well educated. They are looking for subspecialty surgeons these days. So I think developing an expertise in a particular branch is very imperative.
Okay. And I'd also like to bring in one more personal question from somebody, probably a post-intern's perspective. How do people, how different is it from choosing a D ortho or an MS ortho or a DNB in ortho?
Um, so I don't think there are many diploma programs these days. The national board has converted most of the diploma seats to MS or DNB seats these days. Uh, Honestly, if you are in a good center, whether it is a DNB program or a MS program, it doesn't really matter as long as you're having. I have known some really good DNB centers where people are exposed to some good amount of trauma, good basic arthroplasty and arthroscopy. So it honestly doesn't matter once you are out of your residency, and once you're out in the in this entire ocean, whether you're a MS candidate, DNB candidate, it doesn't matter unless you've got the right skills, you've got the right expertise, you know how to manage to how to deal with patient, And if you are good at these, even DNB candidates are doing really good out. So honestly, it doesn't matter whether you are MS or a DNB. It all depends on how you shape your career.
Perfect. And is there any variation in the remuneration between both these courses?
Dr. Anna, I'm not very sure about this, but they are, even the DNB candidates are paid well. But MS candidates, as far as I know, most of the institutions do offer. Private colleges come with some asterisks. I wouldn't want to discuss them here, but yeah, most of the government colleges do offer a good stipend, and the good DNB centers. Well recognized DNB centers do offer a decent stipend for the residents to have a basic living as well.
Okay. And the, after the completion of post-graduation, how does the remuneration vary between different cities, sectors, or based on experience level? So how does it vary
Um,
between a private practice and probably in a government sector, somebody who's doing it there, or a medical college and a corporate setup? How does it vary?
so in the early years, it is pretty much the same. In the early years, as a senior resident, there is not a great variation. You would be paid anywhere close to 90K, starting from 90K, 80K, glowing up to 1.2, 1.3 lakhs. So in the early years of as a senior resident, or in the corporates they call as registrars, even in the medical college you're called as a senior resident. There is not a huge variation in the early years as a senior resident.
And talking about life outside residency, how much free time do residents typically get during their training?
um, Initial years, I wouldn't say, please don't expect any free time. Most of the things you will have to sideline for at least in the first year as a junior resident. Yeah, second year and third year you might get some time to engage in some amount of sports activities, some recreational activities, maybe some gym workouts, or if you are a musician you can even work towards it. Yeah, but first year of junior resident is something that you will have to slog. Unfortunately, that's how things are. Work on some recreational and healthy sports activities.
Okay, so first year of residency is going to be an uphill and a downhill, down slope. I mean, with all the possible, I mean, in ways that you can't expect, that's how it's going to go. But after settling into the field, which I assume is the second year of residency, is there enough flexibility to probably pursue hobbies, travel, or get into a family life for people who've been preparing for PG for quite long? No? Is it ideal for people to get
Okay.
married and start a family?
Family time is something that we never got because I was in a different city, quite far from, I wouldn't say quite far, but yeah, when you're far away from your family, family time is something that you will still miss throughout your junior residency. But hobbies, yeah, if you can get some decent amount of time, I would say, for your to pursue your hobbies. Family time is something that you will still have to compromise most of the times.
If a resident is looking to get married, which year of residency is the ideal time for?
Difficult question to answer. Um, if you can skip the marriage during your residency, that's that's the most beautiful thing that can happen. But if you are bound to get married during your residency, second year is something I would say is a bit of liberal time, because first year you will be working a lot in the wards, you will have a lot of work to do, and in third year you will have your exams, you will have your thesis, dissertations, you will have to present your work in conference, doing some posters, paper presentations. So third year is again a lot of work. So
So,
if somebody is looking forward for marriage, that's the second year, I would say. Okay.
Okay.
But
Yes.
if you can skip that part after the exams, post MS exam is something that you can consider.
Okay. Right. So moving from that aspect to the career prospects and practice settings. On average, how many years does it take to establish a stable career after completing stabilization, the specialization?
So after specialization, after finishing your junior residency, do a decent year of senior residency, 1 or 2 year of senior residency, get work as a fellow for 1 full year. Don't take up any short term fellowships for 3 months, 1 month, 2 months. These are not going to help you in any ways. Do a decent 6 months to 1 year fellowship in a subspecialty. If you can do even 2 years fellowship, that is the best thing that you can do. You're enhancing your knowledge in a particular subspecialty. So post at least 1 or 2 years of fellowship, 1 or 2 years of senior residency, um, uh, things become quite stable. But again, largely it varies on how you want to shape your career. The consultants whom I'm working currently right now, they have a very decent, they have, set a boundary. Okay, because they say after 7 p.m. they're not receiving calls from their family. They've ensured that they have kept time for their families as well. Early mornings you can start anywhere between 6 to 7 p.m., 6 to 7 a.m., and it can go up to 6 p.m. to 7 p.m. So you will have to for 10 to 12 hours a day if you want to have a financially stable life. But of course, things can largely vary on how you want to run your practice. So that is quite variable thing. That's not a fixed thing again.
Okay, sir. And talking about how do the career opportunities differ between the tier one, tier two, and tier three cities. So talking about the
So
tier one cities first.
tier
Yeah.
one is highly competitive. So tier one, even for that matter, tier two cities are highly competitive these days. If you have to get patients to you, you need to be very, very honest. You need to be upfront, and you should have a particular expertise in a particular branch for you to have a good continuous incoming patient to develop a very solid strong patient base. That's how tier 1 cities are. You need to be quite challenging. You need to be very, very solid with your knowledge base. Otherwise, people, at least here in tier 1 cities, they're quite the kind of questions that we get in our OPDs these days. It can be quite challenging, and if you're having any shortfall in explaining them, and if you fumble there, patients will know. You're not a doctor that they really want to be getting treated from, and they can switch doctors very soon. So Taiwan is highly competitive. You need to hone up your skills, and you need to be standing up to the mark. Tier 2 is also matching up something, because when I was doing my residencies, I used to assist the consultants in their private OPDs and private cases as well, theaters as well. So I have seen a good challenge in tier 2 cities as well. It is becoming quite competitive in tier 2. Tier 3 is something, there is opportunity, but there is no good technology, I would say, with respect to research. And if you want to be exposed to some good technology, tier 3 cities are still not up to the mark. Tier 1 city, one big advantage is you are getting updated. In order for you to stay in the race, you will always want to keep updating. You will try to attend conferences, some meetings, workshops. You will want to keep yourself updated with the latest happenings in the branch. So in that way, tier 1 is competitive, and at the same time you will want to update yourself. So that is the advantage of working in a tier 1 city.
Okay, sir. Talking about working at different setups, we're going to be discussing the pros and cons of it. What do you think are the pros and cons of working in a government hospital?
The biggest advantage of working in a government setup is, of course, the security. There might be a storm, there might be a tsunami tomorrow, but you're still not going to lose a job. So job security is at the peak if you're working in a government setup. But the biggest drawback is career progression might not happen very smoothly. And like I said, that you might not be exposed to the latest happenings, the latest technology which the corporate hospitals and the private hospitals have these days. Corporates and privates, they'll always try to stay updated. They will be point on with the recent happenings, and they will try to keep updating themselves. And even the surgeons who are there, they will try to do some new surgeries, some new things which might not be done in any government hospitals for that matter.
To stay relevant, I think corporates are a better call. And what do you think are the
Yeah,
pros
if you
and
want to stay
cons?
updated,
Yes, sir.
if you want to stay updated and if you want to keep learning newer things, yes, corporates are the place. But if you want to have a very stable job, then government is still not a bad thing. You will have good amount of caseload, but it will be still in the form of trauma. But job security is at its peak in government setup.
Yes, we also do have an upper cap of earning limits when it comes to government sector.
Correct. Yes. Yes, that's
And
very right.
yes, some governments also do not allow people to have their own private practice. So if somebody would
Yeah.
be very much interested to go out and explore, I think government might just curtail. Okay.
Correct. Yeah. That is and one other restriction on the practice.
Yes, sir. Talking about what do you think are the pros and cons of being an independent specialist?
Independent private practice, initially the patient load might be very less, so you will have to have a very compromised lifestyle in your initial days. But once you have built a solid foundation for yourself, then there is no looking behind. Independent practice comes with its own pros and cons. You have to be there available to the patient at any point of time, so that's one of the biggest drawback. uh, People might not want to see your junior because they are ultimately waiting to see you, they're paying to see you. So but that's not the case if you're working in as a group in a medical college or in a private hospital, even for that matter in corporate hospital where you are working as a team. So you will always have your backups. In private practice you are all alone, you are the lone wolf. You should know how to manage complications, even if you face any unduly complication, which is a part and parcel of any surgeon's life. So you're on your own, you need to learn to manage those complications as well very effectively.
Okay. So moving on to the next scope of the branch, what do you think is the scope of research in orthopedics as a branch?
Yeah, I think these days it is very, very imperative, whether you're working as a resident, whether you're working as a consultant level. Research is something that you need to be working upon. If you have to be visible to the outside community, to your peers, if you have to be visible to the other co-doctors, co-orthopods, then research is something that you have to be working upon. You cannot just say I will be only building my patient base. That's not how things are going to be in the future. You need to be publishing, you need to be working on some good research, taking up a good research project, work in collaboration. I know it's difficult. It's difficult to find data and it's difficult to find patient if you're working all alone. But if you're working in collaboration, if you're working as a team, you need to work on some good research projects. And at the same time you should also be publishing them in really good peer reviewed journals, index journals. So that is something that will increase your visibility in the market today. So yeah, research is a very, very upcoming thing. It was there in the West. People are focusing that now, right now, even in India as well.
Are there ample opportunities for research there in the specialty, or do you feel it
Yes,
is saturated
and
already?
no, I mean, there are good research opportunities. If you're that person who wishes to do research, you see every patient, every opportunity, every surgery that you see, every patient that you come across, you will always be thinking what different can be done in this patient to improve the outcome. Okay, what different methodology, what different approach, what different surgical technique can be done to improve the overall outcome. So there are ample amount of research opportunities, and like I said, if you are in working in collaboration, you might come across different ideas, and you might come out with some better papers and better research topics. So collaboration and teamwork has to be the key, and there is good amount of research, and there are research fellowships for that matter. Whoever wishes to do things, there are good amount of research fellowships in outside India. Unfortunately, not many research fellowship positions are available in India, but there are good number of research fellowship positions outside India, where you will be working in labs and under the guidance of some senior surgeons, and you will be doing good amount of research and publishing some papers as well.
Okay. And talking about publishing the papers, you did say that it is very important to publish them in reputable journals. What are some journals in your branch, according to your opinion, you think that orthopedicians should look, I mean, the upcoming orthopedicians should look for publishing in?
Correct. So any good PubMed index journal, so the indexing matters a lot in medical branch. So any good PubMed index journal is something that the resident should always look forward to. It is a bit difficult to publish in some international journals like JBJS, Journal of Arthroplasty, Arthroscopy Journal, Injury. So these are some really good top rated, the JOA. So all these are top rated journals, but it's slightly difficult to publish unless your work is quite genuine and you have a good follow up of those patient. There is no harm, they will accept this, but it's difficult. But for an Indian setup, there are good journals such as IJO, Indian Journal of Orthopedics, is a very highly looked upon journal where the residents can easily publish their research work.
Is there any conferences or probably that is conducted annually or biannually you think that residents or post residents should associate themselves with
So
credible conferences?
correct. So national level conferences are something that the residents should always, they should present their thesis work, their dissertation work, and if they have done any posters, IOCON is one such national level conference which occurs every year annually, and I think residents should make it a point to publish one or two papers in the national level conference. There are many more like Oasis Con. There are some international conferences like ISACOS. If you have done good research work in hip and knee areas, so ISACOS is one area where you can publish your work. International conferences can even be in the form of SICOT. But to present your work in an international conference, like I said, you should have done good amount of genuine work and a genuine follow up of those patients, and that's where the acceptance rate by these international conferences will be much higher. Otherwise, the unfortunately your work will be rejected. But national level conferences is something that the residents can easily look forward and present their work. They're quite more accepting in that way.
Is there any website or a portal that the residents can keep in touch with to be knowing about the occurrences of these conferences? Anything to keep themselves updated with the happenings, the latest happenings?
So there are for that there, instead of website, there are some WhatsApp groups which by they're named as ortho conferences. So all the conferences which are occurring pan India, they are published there, so they can stay updated. And there are good number of online courses which are published in that WhatsApp group, so the residents can keep looking up to it. And if there are any conferences that's coming up, any trauma workshops which are being posted, so they can stay updated by staying in touch with this WhatsApp group. It's called as Ortho Conferences. It's run by a group in Mumbai.
Okay. And is there any other organizations that are most relevant in the specialty field?
So I would say AO course, but unfortunately, you should finish your junior residency. Only then you will be able to take part in AO basic trauma course. So AO is something that is quite standard. Residents should make it a point to attend the AO courses once they finish their junior residency. And post, there is one more, the SICOT organization. The SICOT organization is also a well recognized organization. They can log into their website, they can stay upon updated with the latest updates. So these are two things I feel residents should always stay hooked on.
And talking about future trends and technology integration, what advancements do you foresee in the next 5 to 10 years in your specialty sector?
Um, I think AI is creeping in even in the branch of medical field, and I'm not sure if robot is going to stay here for very long, because the long-term results of robotic surgery is yet to be, at least in orthopedics. In general surgery, yes, they have made some quite deep and big advancements, but I'm not sure if robot is going to stay in orthopedics for quite long. But for so far, we have had some good results. I'm trained in robotic surgeries as well. It makes I wouldn't say a great deal, great benefit, but yeah, it does make most of the job easy for us. um, AI is something. AI is being integrated in research work these days, in patient care, and coming to something even more specific, we have something called custom made implants or patient specific implants, where the implants are being designed knowing the patient's morphology. So that is a very good upcoming branch these days.
Okay. And how do you see point of care technology or AI or even multi-specialty collaboration shaping the field in the upcoming years?
Uh, Sorry, Anna, can you please come back?
So we were talking about how AI or point of care technology or even multi-specialty collaboration shaping the field in the upcoming year. How do you see it, sir?
Um, in orthopedics, yeah, like I said, AI is being mainly used for robotic surgeries. And it is being used in research work these days. AI technology is being used in research, and designing implants. So that is somewhere the navigation, the robotics, custom made. That's where the AI is largely being made use of so far. We have not had much invasion of AI right now, but I'm sure it will happen in the future days to come.
Okay. And talking about how people can take their career forward after completing their residency in India, what do you think are the global opportunities after training in India in orthopedics? How relevant is the training globally?
So, like I said, doing one or two fellowships abroad will add. It'll give a very big boost to your resume, to your or to your CV. Working under different surgeons, you get to learn their ideas. You learn to learn how they manage their complications, how they deal with the patients. It's not just about the patient, how they operate and things outside the surgery, outside in the clinic as well. How you deal with patient, that is one of the key thing that every orthopedic surgeon should learn. Because what I feel during our residency, communication is something that is highly underscored. We are not really taught how to deal with patients, how to talk with patients. So this is something, when you do go get an opportunity to train abroad, these are things that you will be focusing on. And unfortunately, research also, for that matter, doing a clinical audit, quality improvement projects, these are highly underscored in our residency program. So when you go abroad, you will learn to collaborate with different surgeons. You will learn how to carry out international researches, how to do some randomized control trials, and how to work in collaboration. And ultimately, you are here to foster a big, long, healthy relationship with some surgeons abroad, so that there has to be some exchange of technology, some exchange of knowledge, research. So that is something that you learn when you travel abroad and do some fellowships abroad.
Yes, sir. Is there any specific additional certification that is required to practice abroad?
So if you have to go to UK and USA, so most of the things are well known. You have to clear Emily for if you have to go to USA, and for UK previously PLABs, but for now, if you are a postgraduate, you can appear for the membership from the Royal Colleges. So that is something that is a mandate these days if you have to apply for any fellowships abroad. For Australia, it depends upon how strong your CV is, how much research work you have done. But Asian countries like Japan, Korea, Singapore, they do offer some good fellowship for which not good licensing exam, I would say, but how strong your CV, how strong your resume, the kind of work that you have done, and maintaining a good logbook for that matter is very, very imperative. Most of the countries abroad, if they have to take a fellow, they will look at your logbook, what you have done for the last 3 years. So maintaining a good logbook is something that was never told to us as well. So I think the future residents should keep a good track of what they are doing on a day-to-day basis. If they are doing a research work, that has to be documented in your logbook. If you are operating on a particular case, so maintain a logbook on that, how many cases you have done on a particular trauma. If you have done some joint replacements, maintain a good logbook. That is something the international fellows, the consultants look forward to when they take you up as a fellow.
Yeah. Now that we've come to this topic, that's something less spoken about, maintaining a good logbook. What do you think are the key
Yes.
points in putting together a logbook that would stand out when I put it forward
So
for
when I was a
others?
resident, unfortunately, nobody told me. So for the entire 3 years of my residency, I maintained one logbook. And then when I came out, I realized when I cleared my MRCS exam and when I started applying for fellowships abroad, I understood how important a logbook is. So if you can maintain a logbook for every year, that's the best thing that can happen. Okay. What is the type of seminars that you are presenting? If you are doing a audit, if you're doing any quality improvement projects, keep a tab on what you did, how you did, what was your outcome, and if you have done some short researches, what was the outcome, how did you do, what was the methodology that you followed. So and if you have done some good number of surgeries, what is the numbers. They don't want you to say, okay, on 21st of Jan I did a tibia nailing, I did a femur nailing. That's not how things. They want a summative. So how many femur fractures have you fixed, how many hip fractures have you done, if you have done some joints, how many joint replacements have you done. So the cumulative number is something that they look forward to. And seminars, if you have presented in seminars, what was the topic, what was the key discussion point, what was the key learnings. So maintaining a good logbook, if you can maintain one for every year of your residency, and even for that matter when you come to your senior residency, maintain a good well documented logbook. Get it signed by the consultant. That is the key, because you might write 101 things on your logbook. Ultimately, what matters is who has signed, whether your heads have seen, whether your unit chiefs have seen them. Is the work that you have done quite genuine? So, getting signed, getting it authorized by your consultant is something very, very imperative.
Okay, sir. Moving to the other aspect, the gender specific consideration. So, are there any unique gender specific challenges or advantages in pursuing the specialty? How conducive is it for females to pursue orthopedics?
Yeah. So, if we had talked about this question a decade ago or 2 decades ago, I think things have been quite different. But these days, it's not just about physical strength. It's nowhere about physical strength. The technology is so advanced. Things have become much smoother. You don't really need to be a human to do some orthopedic surgery. So physically demanding, not at all. I would say orthopedics has been even more welcoming. There have been good organizations. Women in orthopedics is something they are doing quite good research work. They are involved in conferences. they are given some preferences as well in accepting for fellowships. So women are accepted largely, and I have had one of my co-fellow, my co-resident was a female as well. And when I was doing my senior residency, I have had two to three female colleagues. So it has off late, it's been very, very welcoming. Yeah, but there are some challenges as well. But I think it will be ironed out in future days to come.
As somebody who's taking up orthopedics as a female at this point of time, what do you think are the challenges they are likely to face? What are the things that they should take in consideration before taking a call for orthopedics?
Just have a passion for it. Okay, it doesn't matter what the world says outside. If you are truly passionate, if you love this branch, it's always welcome. You're always welcome. You can take up the branch, flourish in the branch. Good. If you're the one thing that I've really noticed is the empathy females can put forward to the female colleagues, what they have put forward to patients. The caring that they put forward is more than what even the male colleagues can do. That is something that I have noticed in the past 6 to 7 years of orthopedics. So in that matter, females have an upper hand. They're quite empathetic when they deal with patients, and when they have to talk to patients, they're more empathetic. So they certainly have a upper hand. Challenges for that matter, yes, the long working hours is something that can have some amount of physical drain. But honestly, if you are passionate and if you are resilient, you can overcome all the challenges that you face.
So if there are any females watching this podcast with a confused mind on whether orthopedics is a yes for you, take this as a sign and go forward. So as
Yes,
we come to
most
the
welcome.
end of yeah, so as we come to the end of the session, we want some words of wisdom from you, sir. So what is the final message that you'd like to share with aspiring specialists considering this branch?
Um, so yes. So if you are somebody who's passionate, who's resilient, who is very, very keen on flourishing in this branch, orthopedics, it's a very, very endearing branch. Like I said, it's quite gratifying when you see patients up on their feet again. The results that you see, the patients when they give the gratitude that you get from the patients is heart filling. And even if it comes to monetary prospectus for that matter, I said, if you are strong, if you are expertise in a particular branch, there is no limit to earning. Sky is your limit to earn. And even if you want to have a good family time, there is good opportunities for you to flourish. We have had really good surgeons who have flourished as a musician, as an orthopedic surgeon. I have known surgeons who are good photographers, who are involved in wildlife photography, and they still have a very busy orthopedic practice. So if you are somebody who is multicultural, who is multi-talented, orthopedics is always welcoming to you. You can flourish the way you want. If you are that person who wants to have a close knit, again, the orthopedics is something that can help you in that way as well.
And what is one thing that you wish you had known before entering this field, sir?
Like I said, during my residency, if there were two to three things that if probably somebody had emphasized to me, the one is the research. I did not take part in good amount of research, so that is something. If to the future residents who are planning to take up this residency in orthopedics, take part actively in research, document everything that you do in the form of logbooks. Okay, get it signed by the authorized person. Okay. um, and of course, surgery, doing the number of surgery, that eventually will come. Your skills, your efficacy, the proficiency, the way you handle instruments, that is all something that comes over time. But I would say the first two things, the research and documenting everything that you do, it was something that wish I had learned something before I joined orthopedics.
As one of my teachers says, once you don't document something, it is as good as not doing the thing in the first place. So people who are looking,
Yes, I think
don't forget to
that's
document
the
and maintain a
wisest
good
word
logbook.
somebody has said. Perfect. Yes.
And coming to our bonus segment, so could you share a memorable case or a moment during your residency that had a lasting impact on you?
From that perspective, I would say I still remember when, because I was working in a tier two city, which was close to quite a tribal area where we had a group of tribal patients who had met with elephant stampede. So we had a mass casualty there. um, it was quite endearing. I mean, it was we were moved by the incident then. A lot of casualties coming in by the wild elephant rampage that had occurred, and the way when I was a junior, I think probably a second year resident, and with the help of our seniors, our juniors, the entire surgical team, we managed the situation very well. We were even helped by the senior residents. Even the consultants who were on call had turned up to the casualty. We managed the scenario very well, and I think we reduced the mortality. Otherwise, I think we would have had a bloodbath then. But the mortality was greatly reduced by a good amount of teamwork. That is something that I will still remember, and that is something that had moved me way back then. And I think that incident is something that I will still remember forever in my orthopedic journey.
So do you have a number for the number of casualties that you had to encounter that day?
I think it was somewhere between, if I'm not wrong, I think it was 12 to 14 cases that we had in one go.
Okay, that's so nice to hear.
And most of them are were polytrauma patients who had associated not just long bone fracture, they had chest injuries, abdominal injury. So that's when we worked in collaboration with the general surgery team, and I think we gave a really good self care to all to the patients there.
As much as how many ever cases we had seen during the course of it, elephant stampede is not something that we encounter on an everyday basis. And in spite of
Correct.
all the difficulties that the medical branch has to offer in terms of toxicity or whatever we name it, it is indeed gratifying at the end of the day when you save a life. Yes, sir. So, do you want to share anything more? Is there anything else that you would like to share?
So that's it. I mean, to anybody who wishes to take up orthopedics, it's a beautiful branch, quite gratifying for that matter. You ultimately, when you go back home, you should have a peaceful sleep, saying that you have done a fair job. You have delivered the best service to your patients. So that is the ultimate pleasure that you get from most of the surgical branches, and orthopedics does the same. So welcome to orthopedics. Work hard for it. Get into really good institutions. Get exposed to all kind of surgeries. uh, Collaborate with your seniors, maintain a good rapport, and always don't be egoistic. Whether you are in second year, third year, whether you become a senior resident, always stay in touch with your seniors. Will always help you in your long course. Initially, yes, when you are learning, always bow your heads. There is no harm to it. But yeah, if you're facing toxicity, be upfront. Speak to speak to your friends, speak to your colleagues, take the help of other seniors who are good to you. And keep your ego aside, keep learning. So that's the most key. You have to stay, keep learning and updating yourself. You will flourish ultimately.
Okay. Thank you for the closing note, sir. It's indeed a very much of a pleasure to host you today. And it was such an insightful discussion. And for people who decided to click on this podcast with so many doubts in mind, I hope we've addressed all of it. If there's anything else, please feel free to put it down in the comment section that we might address a little later. So thank you so much for giving us your time, your energy, amidst your busy schedule for us to do this for our undergraduate and PG aspirants. So thank you so much once again.
Thank you, Anna. Thank you to the entire team of KYC. It was quite pleasurable. You brought back a lot of memories from my residency. The journey with you you brought a lot of memories from your journey. I mean, it's not been long enough, but I would still say it was quite memorable. Thank you for having me today. Hope you have a great day.
Thank you once again, sir.
Thank you. Thank you so much.
And for others who are watching, we are the team of KYC Know Your Calling, which is founded by Dr. Devi Bogali, who is doing his neurosurgery residency at Jubilee Mission Hospital, Thrissur. Sir is the founder and mentor of Map of Knowledge in MBBS and the founder of Know Your Calling. So, Sir is trying to be an elder brother in this process to help us all navigate through the difficult journey of medical education and specialization. Thank you for watching and stay tuned to see our next podcast. Thank you.